The association between childhood sleep apnea and the symptom of bedwetting is really an intriguing one. When a child has sleep apnea, or what we call pediatric sleep apnea, where they're not breathing well, then the amount of oxygen that's getting into their lungs and therefore the rest of their body isn't ideal. And the body has a way of wanting to preserve oxygen for the vital organs like the brain and the heart and so forth. And so in these situations, we wind up altering the stress hormones because we're choking. That's what sleep apnea essentially is a constriction of the airway. And it creates not only a restless sleep for these children where they have nightmares, night terrors, restless turning, tossing, turning, just very uncomfortable sleep.
It helps me breathe better, like get more air. It actually helps me sleep better and not wake up as much.
So it used to be like the way you could tell if he was asleep was you'd open the door to his room and you could hear him breathing across the room, and that's gone away. So he is quiet when he sleeps now. He breathes more normally.
But they also lack normal or ordinary bladder control. Obviously that's age related. You wouldn't expect a 18-month-old necessarily to have conquered control of their bladder, but certainly an older child we would expect to be dry at night. But 18% of our children are not dry when they should be dry. That's a very big statistic. And so when we correct the tongue habits, when we get the airway open and we resolve these issues with childhood sleep apnea, then these other symptoms such as bedwetting, the social behavioral symptoms and so forth begin to go away and dissipate, and they become normal again.